Officially spring, and while the warmer temps and growing flowers are things that we all look forward to, it also brings its fair share of allergies. So Dr. Kirsten Kepfler is an allergist at Riley Children's Hospital, and she's joining us this morning to talk about all the things that you can do to protect yourself this season. So thank you for joining us. We appreciate it. So for starters, some allergy symptoms have actually started a little bit earlier than normal this year. What may be the cause of that?
So we saw a warming of our temperature, and we saw the trees start to pollinate. And so for people who are allergic to trees, tree pollen, their allergies have already started. While we went cold again, people started to feel a little bit relief, and as we warm up again, those symptoms are going to come back.
Yeah, February was definitely the fake spring. You know, we saw very high temperatures, and I even felt something starting to bloom because I have seasonal allergies. So what should people do if their symptoms haven't hit before they hit? What are some things they can proactively do now?
That's a great question. So in a clinic, what I usually advise my patients is to start their medicine now. We know it's coming. So go ahead and start taking your cetirizine or your Claritin, your Allegra, your Zyrtec every day. Start using your nasal spray every day, and that will really help with your symptoms.
And speaking of those over-the-counter medications that you were just talking about, are there any other ones that you recommend for this allergy season?
So for antihistamines, we like the newer ones, which are the things like Claritin, Allegra, Zyrtec, or their generic version. And then for nasal sprays is actually the best treatment for allergic rhinitis. So we really encourage people to try things like Flonase, Nasacort, Nasonex. There's quite a few, and really they're all about equally effective.
And then, you know, this may be a silly question, but allergies, the symptoms can look different in a lot of different people. What are some of the main things people should be paying attention to know if they do have allergies, or if it's a cold, or if it's the flu?
Right. So for allergies, usually you'll start to notice they're happening at the same time every year, whereas a cold wouldn't happen at the same time every year. Both you'll see things like congestion, sneezing, runny nose. With the allergies, you're going to get a lot more itching. You're going to see kids a lot of times, and even adults, scratch their nose. They feel like the insides of their ears itch, their throat itches, they're clearing their throat a lot, trying to scratch the back of their throat. And then they get a lot of watery, itchy eyes. When it's a cold, you might get some fevers, you get a lot of more joint aches and pains, and we don't see that as much with allergies.
Gotcha. And see, this whole time I thought I was allergic to work, and it's just the spring is back. So talk to me about skin testing. What is that, and why should people get it done? So
we usually do skin testing to help guide our treatment plans. If patients have tried a lot of the over-the-counter medications and they just aren't working, we'll go ahead and pursue skin testing. That helps us counsel them, helps us tell them what time of year they need to be taking medications, and if they can take any medication holidays. Sometimes if there's a pet in the house that's causing their symptoms, we have to talk about ways to help with that. And so skin testing is really pretty easy. It's just a small scratch of your skin, and then within 15 minutes we can tell you what you're allergic to.
Okay. And lastly, before we go, any other types of tips that people need to know as they navigate this upcoming allergy season?
Really, medication is one of the best things. Saline nasal rinses help quite a bit as well. And just you know, coming inside, if you're playing outside, a child is playing outside, or if you are working in your garden, come in, immediately wash yourself to try to get the pollen off your body. Use a saline nasal spray to rinse your nose out, and then wash the clothes you've been wearing. Don't rewear them.
Okay. Perfect advice from the doctor yourself. Thank you so much for joining us this morning. We appreciate it. It is